This is a short module on TED Stockings. I'm Jean Howell and I will be your facilitator. Our objectives will be to number 1, to understand why a client would wear TEDs, number 2, to describe how to properly care for TEDs, and then third, to demonstrate the steps in applying a pair of TED hose for a client. What are TED stockings? I thought a fellow named Ted invented them. However, this is not true. TED hose are medically prescribed, tight-fitting stockings. Their main purpose is to aid in healthy blood flow and to prevent the formation of both stationary and mobile blood clots. TED, or TED, is an acronym that stands for thromboembolic disease or thromboembolic deterrent. When a person is recumbent or bedridden, blood clots can form due to impaired venous return of blood. Blood clots are a high cause of death in disease in adults. A blood clot can travel to different parts of the body, including the lungs and the brain. A blood clot in the brain can cause a stroke. TED stockings put gradient pressure on the leg muscles, meaning that there is more pressure applied at the ankle than at the calf, thus promoting venous return to the lungs and preventing blood clots. Come in different lengths and pressures and are fitted according to the size of the client's leg. Hose that fit too snugly can lead to further problems, while loose-fitting stockings often do not perform properly. Medical professionals determine if the client requires knee-high or thigh-high stockings and the compression needed. Most TEDs have a hole in the toe, which allows medical professionals to check the temperature, color, and pulse in the feet. DVT, or deep vein thrombosis, is a potentially life-threatening illness. This is where blood clots form deep in the veins of the leg. It causes pain, swelling, there's warmth and redness. There's a constant dull ache or a tightness in the calf when walking. In this condition, pieces of clot can break away, traveling to the heart and then obstructing pulmonary circulation. It's estimated that approximately 1 person in 20 will develop DVT during their lifetime, and 20 to 70% of all hospitalized patients will develop DVT. I don't know if you recall the story of the journalist from one of the major newspapers was embedded with the troops in Iraq, and he was with the soldiers giving reports of what they were doing on a day-to-day basis. He was riding in a Jeep or a Hummer or some kind of a tank for long hours, and he developed DVT in his legs, and he subsequently died. There are a number of risk factors for developing DVT. Hypercoagulation is certainly at the top of the list. This is blood changing from a fluid to kind of a semi-solid mass. Coumadin regulates the viscosity or thickness of blood so it remains fluid and flows easily through the vessels. Cancer, obesity, pregnancy, smoking, any kind of surgery, trauma, a head injury, birth control pills, sitting for a long period of time without moving your legs or moving around, these are all factors that can contribute to DVT. Specific surgical procedures come with the risk of blood clotting and poor circulation, especially in at-risk patients or those taking blood medications. Some patients are required to wear TED stockings prior to surgery to prevent clotting before or during their operation, and stockings are generally worn for 1 or 2 months following surgery or during periods of inactivity that sometimes leads to clotting and circulation problems. For those suffering from poor circulation, commonly seniors, TED hose are worn regularly or under specific circumstances. The stockings help keep the legs warm and blood flowing properly so patients can be more active in their day-to-day lives. Some people wear TED hose when flying, as high altitudes sometimes impede blood flow. With the legs warm and active, the heart can properly pump blood through the rest of the body. Clients who are prescribed TED hose keep the stockings on throughout the day. It is ideal to put them on before rising in the morning. Then they are usually removed once a day for bathing or at nighttime. Removing the stockings also helps the legs get sunlight and some fresh air. Although TED hose fit closely to the skin, they tend to bunch up and bind the joints. Therapists and other caregivers, as well as the client, routinely inspect the stockings for runs and to ensure that they don't hinder circulation. There are some circumstances when TED stockings should not be used. Anyone who has a recent skin graft or skin condition such as dermatitis or cellulitis, any open sores and gangrene would contraindicate using TED hose. TED should also not be used if there is a severe vascular disease and may not be used in the case of extreme swelling of the legs. When wearing TED stockings, there are some warnings that should be heeded. The legs cannot be massaged or crossed. Wrinkles should be avoided. If sitting, the legs need to be elevated. The client should also check for any allergic reactions. That might be elastic at the top of the stocking. And always change the stocking if they become wet for any reason. I'll go through the steps now on how to apply a pair of TED stockings. If the foot is clammy or damp or the leg, it's ideal if you've got a little cornstarch or baby powder handy because it helps to reduce the friction and resistance when you pull on this tight stocking. But as I say, it's an ideal situation and you may not have that luxury. But you want to insert your hand into the stocking as far as the heel pocket, and then you grasp or pinch the heel pocket between your thumb and your forefinger to be sure that you hold that as you're turning the stocking inside out to the heel area. And then you pull it up to the client's heel and just make sure that just that foot part up through part way up the heel is nice and secure. For knee-high stockings, pull the stocking up and fit it around the ankle and the calf, working gradually to the final position. And that final position is about 1 inch below the kneecap. Check for any wrinkles and adjust accordingly. For thigh-high stockings, begin pulling the body of the stocking up around the ankle and calf, all the way up until the top band rests in the gluteal fold. This is just at the bottom of the buttocks. Check for any wrinkles and adjust accordingly. And then don't forget to remove the stockings at bedtime unless it would be contraindicated in the care plan. In a couple more slides, I'm going to show you a video where I will demonstrate how to do this. And really the best way to learn how to do it is just to practice, practice, practice. Do it on each other before you get to the client. TED stockings are very expensive, and you'll need to know how to take care of them properly. While they're very durable, they can still absorb sweat and other bodily fluids, especially in the elastic bands, and they need to be laundered frequently. Prolonged wear is not recommended. Simple cold or warm wash cycle or a quick hand laundering usually keeps them clean. 10 to 20 minutes on a low heat dryer setting is all that's commonly needed to dry them after washing. Most people simply wring them out in a towel and then hang them on a rack to dry. Never bleach a pair of TED hose. It'll break down the fibers. Like all stockings, TED hose can get runs. The fact that TED hose are much tighter fitting than other types of hosiery and stockings makes them difficult to put on without a lot of pulling and tugging. This also makes them much more susceptible to snags and tears and holes. When there are holes in the stockings, it means that they cannot effectively do their job. So it's important that TED hose be changed if there are any signs of runs, snags, tears, or holes. You will be the eyes that sees the stocking every day, so stay alert. A resident with poor vision or arthritis will not be able to monitor their condition like you will. As I said before, these stockings are expensive, and usually the resident will have 2 to 3 pairs so he can change them when soiled or wet. Care for them as you would your own, even better. Now, here is the video showing you how to apply a pair of TED stockings. Morning, Vicki.
Good morning.
I'm Jean, and I'm here to help you put on your TED stockings this morning.
Okay.
All right? All right, we'll slip your shoe off here. Roll your leg up. Did you have a good night last night?
I did. I slept very well.
Good.
Thank you.
I've got some talcum powder here that I could use, but your feet feel nice and dry, so I don't think we need to use it. Sometimes they use cornstarch, but you don't find a lot of cornstarch in apartments these days. So here's your TED stocking with a hole in the bottom. And I'm just going to slide my hand into the stocking, right down to this heel area here, and I'm going to kind of pinch that heel area together, and then I'm going to put the stocking inside out, holding that heel area. Get that nice and smooth, and now I'm going to fit that heel area onto your heel. Okay, and then I'm going to just unwrap it here and pull it up about an inch below your kneecap. Get all those wrinkles out. Now, if I want to take a peek at your toes to see if they're nice and pink and healthy, I can just pull that back, and they are. Would you stand up for a second, Vicki? Now, if I was to put a thigh-high hose on you, I would go all the way up just to this gluteal fold right in here. Okay? All right, you may sit down. Now, we're going to fast forward, and it's the end of the day. You're going to bed, and I'm going to take your stocking off. So I'm just going to unpeel it here. Pull it down. Slip your shoe back on so you can make one last trip to the refrigerator. And then I'm going to take your stockings probably into the bathroom. I'm going to get some warm soapy water, and I'll wash them out, and I'll rinse them in some warm water and probably wrap them in your bath towel to dry them, and then just hang them up on your bath towel. They're all set to go for the morning.
Thank you.
Thank you. You have a good day.
You too.
Thank you for your time and attention today. If you have any questions about this, please ask your supervisor. And when you are ready, you may take the assessment. The skills demonstration will be scheduled with your nurse.